There are several bones which make up what's called the facial skeleton. We've got the nasal bones, the maxilla, the zygomatic bone, the lacrimal bone, the vomer, the palatine bone, and the inferior nasal concha. So we have got these nasal bones up here, which articulate with the frontal bone and with the maxilla on the other side, and where they meet the frontal bone, where they join together, this point here is known as the nason. And here we've got this bone here is the maxilla, and this, as you can see, makes up the medial part of the orbit, as you can see here, and it's got a few processes. So this process is called the frontal process because it's articulate with the frontal bone. And then we've got this process here, which is the zygomatic process of the maxilla, because it's articulate with the zygomatic bone literally. And then this here is called the alveolar process because it articulates with the teeth. So you've got the alveolar process, the zygomatic process, and the frontal process. So that's the maxilla bone. Next, we've got the zygomatic bone, which is referred to as the cheekbone. It's the bone here which articulates with the temporal bone here, the frontal bone, and the maxilla. So this big hole here is called the birefrom aperture, and that's obviously where the nose sits. So you can see this structure here. This is the perpendicular plate of the ethmoid bone, and these structures that you can see from the anterior view on either side are the concha. This structure here is the inferior nasal concha. You can see here, and it's the and it's part of the maxilla bone. Next, we've got the little lacrimal bones, these tiny bones that lie here. So anteriorly you've got the maxilla, and then you've got the sphenoid bone, the zygomatic, and the frontal bone. This is the lacrimal bone here, this little bone. This whole structure here is the hard palate, and if we look posteriorly, you can see the vomer here, and you can see the palatine bones and the maxilla, which makes up the hard palate, this whole structure here. So let's recap what we have gone through. The bones of the facial skeleton. We've got the nasal bones, the maxilla, the zygomatic bones on the other side, and we have got the bones which we can see through the birefrom aperture, the inferior nasal concha, which are part of the maxilla, the vomer, and the palatine bones, and the lacrimal bones on other sides. Body planes and landmarks. Certain surface landmarks and localizing lines must be used for accurate positioning of the cranium, and they are glabella, nason, acanthion, mental point, supraorbital groove, superciliary ridge, interpupillary line, angle. Positioning lines: acanthometal line, libsmetal line, mentometal line, glabellometal line, orbitometal line, infraorbital metal line. We will demonstrate the following positions. Lateral position. Clinical indications: fractures and neoplastic or inflammatory processes of the facial bones, orbits, and mandible. Waters method: fractures, particularly tripod and Lefort fractures, and neoplastic or inflammatory processes, foreign bodies in the eye.
Position: remove all metallic or plastic objects from head and neck. Best position erect or recumbent, semi-prone. Part position: rest lateral aspect of head on table with side of interest closest to a receptor. Adjust head to a true lateral position and oblique body. Align mid-sagittal plane parallel to image receptor. Align interopabular line perpendicular to image receptor. Adjust chin to bring infraorbital metal line perpendicular to front edge of image receptor. Shield radiosensitive tissue outside the region of interest. In center ray, the center ray should be on the zygomatic bone. Evaluation criteria. Anatomy demonstrated superimposed fissure bones, greater wings of the sphenoid, orbital rofts, cilia turcica, zygoma, and mandible are demonstrated. An accurately positioned lateral image of the facial bones demonstrated no rotation or tilt. Rotation is evident by anterior and posterior separation of symmetric ventricle bilateral structures such as the mandibular rami and greater wings of the sphenoid. Tilt is evident by superior and inferior separation of symmetric horizontal structures such as the orbital rofts and greater wings of sphenoid. Contrast and density are sufficient to visualize the maxillar region. Sharp bony markings indicate no motion. In patient position is erect or prone, and remove all metallic or plastic objects from head and neck. In bar position, extend neck, resting chin on table, adjust head intermittent line is perpendicular to plan of image receptor, and orbital line from a 37 angle of table. Bring message plane perpendicular to midline of grid or table, and preventing rotation or tilting of head. Shield radiosensitive tissue outside region of interest. In center ray perpendicular to image receptor, to exist between mouth and nose at anxion. Evaluation criteria. Anatomy demonstrated. Inferior orbital margins, maxillar nasal septum, zygomatic bone, zygomatic arch, and anterior nasal spine. Correct neck extension show vertex ridges just inferior to maxillar sinuses.